Hi, LaKeesha. Welcome to the podcast. How are you?
Good. How are you?
I am good. Thank you for joining me today. I know you're not feeling your best, but I appreciate you for sticking with it and showing up anyway.
Of course. Of course. Thank you for having me. When I looked on my calendar, I was like, I do not know if I'm ready for this. But of course, talking to you anytime, it's a pick me up. So I'm happy to be here.
Aw, I appreciate that. I thought, you and I go way back, and I really think that you're not trained public health, but there's so much overlap in what you do and how you serve with public health. So I really wanted to introduce you to my audience and share about your story and kind of what you do. I think my audience will find that as a valuable resource, and we do have a lot of people that are interested in what you do just from like a different like niche perspective.
Right.
So let's start with early on. I like to always like to hear the journey of how you got to where you are. So kind of go back a bit and tell us, a little bit about you, and then
Mhm.
like your background, and we'll kind of work our way up the journey.
Sounds wonderful. Well, my company is Bell Tower Consulting Group, and I always knew that I wanted to go into the social work, people serving field. My bachelor's degree is in psychology. I went to Jackson State University in Mississippi, Jackson, Mississippi. And yes, after that, I came back home to Miami and I started going to Florida International University. And I started out in organizational psychology and I quickly switched over to social work. It was not for me at all. I switched over to social work and I knew that I wanted to do nonprofit, but on the administrative side more so than the actual direct services. So I tried to do nonprofit management, but back then nonprofit management was not as popular as it is today. So my specialty was in children and family therapy. I practiced mental health therapy for a while. Hated it.
Oh,
Those that provide mental health therapy, my hat goes off to you. It is a wonderful field. It was heartbreaking for me.
yeah, yeah.
And I chose to start working at a nonprofit organization. I got hired with a nonprofit organization as a program manager. And I was on the post award side, which is after we get the grant, I will oversee the staff. I will make sure that we meet all of the deliverables, all of that. And eventually, the executive director started asking me to move slowly into grant writing. And I mean, I went into it kicking and screaming. I was like, no, I don't want to do it. This is not for me. Leave me where I am. We have a grant writer for that. I'm good. But he just kept pressing, kept pressing, kept pressing. And I started writing. And I've been writing ever since.
So
Yes.
you just that's the thing about grant writing, is we learn the concept and we know the purpose and all that for grant writing, but the only true way to learn is to just start doing it.
Exactly.
Yeah, and
Exactly.
that's stressful for some people to even think about, but you just, you get in there, you start doing it, and
Mhm.
you figure it out as you go. Um, wow, well, I didn't know that part about the mental health therapy. I didn't know that about you.
Yes.
I always discover something new when I interview my friends and people I've known for a while. There's still something in the new that I discovered during these episodes.
Yes.
So that's really interesting. So, is there nonprofit management? Uh, and now I'm going to back up too. I did find that piece about organizational psychology, but I didn't realize that he was like, oh no, he kind of went that way. And was like, did like it because I thought, oh, that's a very interesting. But it honestly, my brain is ticking. I know that you get a lot of compliments of how you are as far as leadership. You're a great leader with your team, and I think that maybe some of that early training kind of spilled over. Uh,
It did. It did. I enjoyed organizational psychology and just that whole process of helping people go through change and helping businesses go through change. I wanted the practical side of it. I did
Okay.
not want all of the research papers and the studies and I didn't want all of that part of it.
Yeah.
So social work and the nonprofit management was a good fit for me because I got a good balance of writing the paperwork, getting that information, but also actually going in and practicing.
Yeah.
Yeah.
Okay. I definitely
So
understand
that's
that.
why it was a good fit for me.
Yeah.
And my professors, they were wonderful because even though they understood that I wanted the nonprofit management side of it as opposed to the therapy, when I started doing my internships, I was able to intern at an organization where they helped me do that community outreach and community engagement and get more into the nonprofit. And actually, the person who gave me that opportunity is our current mayor.
Oh,
Yeah.
nice.
Yes,
Nice.
so it was
I
wonderful.
and I always love to hear anybody's connection to Mississippi. I have, my family, a lot of families still in Mississippi. So whenever, and I knew that you had gone to Jackson State, but I have family that have gone there and other schools in Jackson. In fact, my older brother went to medical school in Jackson.
Mm,
So we have a lot of connection to Mississippi. So I'm always excited when I hear
yeah.
about that. Um, so how did you move? I'm assuming you probably worked in that for that nonprofit for a while. You said, you continue to do that work, but did you leave there and then start Bell Tower, or how did you decide to start Bell Tower? And is there a special meaning with the name?
Exactly. After I left there, I I was looking what to do. And it just so happened that the executive director that pushed me into grant writing encouraged me to start a business
Oh,
for
okay.
grant writing. So once I left that nonprofit organization, they say, what do you have in your hand? And my business is what I had in my hands. So I went with it and I started reaching out to those people in my network and letting them know that this is where I was, asking them to be change agents for me. And that's how I started to get clients. And of course, in the beginning, my focus was on those nonprofits, particularly those small nonprofits. And that's how I started. But the name is also significant.
I never knew. I never asked, but I felt like it had to be.
It is significant. So my dad, he also went to Jackson State. So I'm second generation. His last name was Bell. My stepfather, his last name was Bell, and he always raised me. Him and my mom, they raised us to be entrepreneurs. So all of my siblings, we have some type of a business. And he had just passed away. So when I started Bell Tower, I chose Bell in honor of him, and then Tower because when you look over a cityscape, that Bell Tower stands out, and you want your grants to stand out from the crowd. So I chose Bell Tower
Oh,
Consulting Group.
I love that.
Yeah.
I did. My business name is just my name. I wish I just need to get started. So, I love to hear that name with the meaning behind it, and that's something I thought about it. I would think about it, but never like by the time we're in a conversation, it's not top of mind to ask. I usually think about it after.
Yeah.
What a great way to honor him and a tradition, and I like that a lot. I like that.
Thank you.
So tell us about where you are now, because when I first met you was we have the same business coach,
Right.
and I remember the first time, well, before I actually met you, I heard your episode, like your first episode with her,
Mhm.
and on her podcast, and I was thinking to myself, I loved how she coached you through. Like she's,
Yes.
um, Natalie Ekdahl is our coach, and the podcast is Biz Chicks Podcast. And
Okay.
Natalie, as in her very, the way she does it with such care, she guided you to this niche about with the cities.
Mhm.
And I just remember hearing it, and I felt like I was like sitting in the room, and I was like, "Yeah, oh, that makes sense." I was so excited
Mhm.
for you. And then later on, I got to meet you, and we talked more. So tell me about your special niche. Tell us about how you serve and who you serve now.
Yes. I niched into working with cities and counties in Florida. I did that around what was it 2013. I started playing around with it, started working with municipal governments. Actually, it was a client of mine that was closing down his nonprofit organization and he saw a post for one of the cities and sent it to me. So I applied there. town of Cutler Bay, and then another friend of mine sent me North Bay Village. So those were my two cities that I worked with. And I started working with them for a while, and having that conversation with Natalie kind of confirmed, that it's time for you to start to niche. And
Yeah.
I enjoy doing that because I still get a taste of that social work field, because we're doing everything: after school programs, senior programs, plus the drainage and the parks and all of that. But I don't have to worry about being everywhere. I don't
Yeah.
have to know about all the things about grant and all the different types of grants that are coming out. And I'm able to really be focused and build those relationships with those funding agencies to the benefit of my clients.
Like that. And now how many different cities? Because are you serving or, yeah, around Miami?
Right now, I have around 7 cities that I work with. Yes, 7 of us that I work with. I have a couple of more that I work with as needed, but my core, 7 of us. Oh, sorry. I thought I closed my sound off.
Our editors can probably take that out.
Yes,
So, okay, so 7, it's a lot,
it is.
but you also have a team, so
Yes, I have a team and of 7 also. So it is a lot, and because of the way that we have two separate ways that we have our clients. Some might be project based and some are retainer based. And because of that, we're able to spread the work out. So usually we can have a grant writer that's able to support multiple clients. So it's manageable.
okay. So you planning to, what do you have coming up new? Are you looking for, I guess probably just more cities in around the area, um, and continue with grants? Like what do you have coming up? I know you got some stuff you've been working on, so.
Yes. Yes. Well, of course, we always are looking for more clients. Always looking for more clients. We are scaling our business through government contracting. So that means searching for requests for proposals for cities and counties that are looking for grant writers or to hire a pool of grant writers. We're constantly responding to those. We have some clients that we might have worked with in the past that we're reaching back out to see if they're interested in coming back on. And I do also want to get into some more workshops.
Yeah. So that's a great segue because um, one of the things that, we do for years now, I've offered a program that supports entrepreneurs and public health that are just getting started or who are already established and are just wanting to connect with other entrepreneurs and kind of level up their business.
Mhm.
Most are consultants, but we have all different types of entrepreneurs in the group that we support. And in our expo, which is that program that I have every year, the one that we're kind of at the time of this recording are
Mhm.
wrapping up the online portion and preparing to meet in person for the people that are coming to the in-person retreat. But we had a series of 6 workshops, live workshops in this online portion, and you spoke at one of the workshops on the topic of RFPs and sharing tips, and it was insightful. I mean, I personally took, like a full page of notes, and I know that the attendees were really getting a lot out of that and a lot of value out of that. And it was eye opening because, again, you and I have known each other for a long time. Some of the things that you shared and talked about during that workshop, you've talked to me about, over time, but it was something different about you did a demo and you were able to explain some stuff. So I love that you have, that you shared that with us and that I mean, I realize you carry so much value around. I think that happens to a lot of us. When you're really good at something, you have a lot of information, knowledge. You almost forget how valuable it is because it's just second nature to you, or somebody else is like, what? I didn't know that.
Yes.
And that's how I felt listening to you.
Mhm.
So I'm going to say here on the podcast is it maybe if you could just take maybe a couple of general tips because you shared with us from 2 different angles of
Mhm.
RFPs. So maybe just start with just kind of explaining the RFP, because you did a great job of just explaining the purpose of that to us too. Maybe start there first, and then we can talk about a tip that you can share. But let's just explain what an RFP is.
Of course, the RFP or request for proposal, we also hear them mentioned as ITNs, invitation to negotiate, or RFQs, request for qualifications. These are contracts that government agencies place out when they want to purchase something. And it all starts with understanding the procurement process, how governments are required to procure services, or agencies that receive grant funding. So that can be a hospital, a city, a county, a tribe. It could be anything, anyone that's getting grant funding. And they're required to follow certain procurement standards. And once you learn those procurement standards and they put out that RFP and you respond for the services, it can be, for me, I'm looking for grant writing. Grant writing, grant management is what I would look for. But let's say that they wanted to put out something for nurse educators, people to come in and do some training, and they know that that's going to cost above whatever their threshold is for them to just pick up the phone and call someone and have them come in. They have to put out an RFQ or RFP. And once they put that out, you can respond to that. And if you get selected, you'll have that government contract. And the value of it is you can take that contract and it can potentially parlay into other contracts for you.
Yeah, I know that it can be a daunting topic for a lot of entrepreneurs that are getting started and trying to figure out what to do and the best use of their energy. I have my own kind of filter for that, and I think everyone has to kind of decide, what that means for them. But you did such a great job of kind of really diving into that during the workshop. Here on the podcast, I think that before I get to you sharing the tip there, I think after hearing you in that workshop that you presented with us, I think that it could be of value if there's any organization that is in this process. Maybe internally, this is what you put out, and you said, if you have a event, an opportunity or need to educate people about the topic, about the need. Maybe it's your internal team, or maybe you want to educate people that are going to be submitting RFPs. I think you would be a great person to contact and bring into, to lead a workshop on it, or to do a training, or to just speak to a group of people on a topic. So I definitely, for my audience listening, if you're in a position and you're looking for someone to speak or on a topic, related to RFPs, I highly recommend that you contact LaKeesha, and we'll have her contact information in the show notes, because I didn't realize like I said, I've known you for a long time, but I didn't realize the wealth of information that you're just walking around with. And I think this could be very helpful, very valuable in those settings. So I'm biased because, yes, she's a good friend, but I also witnessed a testimony. I witnessed firsthand because she led a workshop for our organization, and all the attendees raved about the topic and the value. So that being said, is there just maybe one or two tips in general that you could share on the podcast about for somebody that either perspective, because you gave us different perspectives, grant perspective and seeking new business. So is there something that you could share with our listeners?
The first thing that I would say is, if you have in mind, make sure you have in mind who you want to serve. Who is your ideal client? And then you start to seek out that ideal client. If it's a certain hospital, you want to go to that hospital's website, find their procurement site, and start to study it. Learn what their policies are. Learn what kind of RFPs they put out, and pull down one and read through it. Can you do the work? One, can you do this work? Can you absorb it? Can you meet all of the criteria, the insurances and the bonding and all of those things that go along with government contracting? And if you say, well, I'm not ready yet to be a prime consultant, start to look at those people that actually get the money and see if you can partner with them as a subcontractor. Build those relationships. It all goes back to relationship building. That getting that bid is just one little part of it. It's still relationship building in the end.
Yeah, I'm glad you added that in there too, because I think that we always assume we can get caught up in the numbers and the sites and the details and the data and forget that there are people behind
Exactly.
every part of that. So building those relationships is important. I mean, but this can also be helpful for when you, well, first of all, just knowing that this information is just there on their website. You can access that. It's freely available. You can find out what they have, what's open, who they're looking to hire to do what. You can find out who is, like you said, the primary, and there's a couple options there. But then that networking piece is, then go over to LinkedIn. And you all knew I was going to bring up LinkedIn on this conversation. But go over to LinkedIn, and once you get that information, and connect with those people, and be genuine and sincere, not spammy, but just connect with them, have those conversations, and see um, how you can, collaboration is powerful. How you can come together, ultimately serve that larger client, pulling your resources together, and being able to pour in, and where you fit in. Um, and not be afraid of trying to reach out and trying to connect with people. I think that's the thing, or not so much even being afraid. Sometimes that people are afraid to kind of step out that way, but don't underestimate the power of being able to do that.
Right, right. That's definitely true. That connecting, because I have right now one project, one contract that I have where I'm a sub, I'm not the prime. It's the engineering consultant that is the prime because it's an engineering project. However, within that bid, they needed some grant management. So they reached
Yeah,
out to me and I'm able to be that sub consultant. So if you familiarize yourself with those contracts, you'll see where you can fit in. There might be an evaluation piece that you can provide consulting on, or there
right.
might be a subject matter expert piece that you can provide that consulting on for that prime engineer, for that prime consultant.
Yeah, yeah. So see why I'm recommending, everyone listening, why I'm recommending, she's just so knowledgeable on this topic. So I think that's great information, and and we really are all connected. It's we can't stay siloed with just strictly this narrow niche that I'm going to stay in. And public health, it overlaps so many industries. We can't stay strictly siloed in public health. We really need to broaden, overlap, and connect with people to really strengthening our networks, and thinking of it as like a fabric, so that we can have a greater impact, and these cross collaborations. All of this is a powerful step into the impact that we want to have on communities that we serve.
Yeah,
So,
it definitely does. I mean, even in the work that I do, I lean heavily on the public health aspect of it. If I'm writing a grant for a park, I need to know, why do we need a park in this area? I need to look at the health data in that area. I need to look at where the bike lanes are connected. If I'm working on a project for drainage, we're talking about water quality, improving the quality of the drinking water in the area. We're
yeah,
talking about managing the septic and sewer systems and not contaminating, no pollution, and the impacts of that on public health. So
yeah,
public health is everywhere.
yeah, absolutely. Perfect examples. Thank you for sharing that too. That's what I love about the conversations on this podcast. And that's my hope, is to really be able to help people see that, how we overlap, and have a better and a broader understanding of public health, and also to find ways to partner um, in these cross collaboration efforts to to get what we need to the community. So great examples. Thank you for sharing that. We're gonna wrap up. I know you're not feeling well, but my goodness, you did so well, and you shared so much with us. And I just appreciate you so much for being here.
I appreciate it too.
Where can everyone connect with you? Of course, we're going to share links in the show notes, but just for someone listening, how
On
is the best?
on my website, belltowergroup.org, on LinkedIn. Now, if I don't write you right back, just know that I'll get back to you. LinkedIn, and email. Email is
Okay.
the absolute best way.
All right. Well, we'll connect, have links for everything in the show notes. But thank you so much, my friend, for being here and for sharing so much with my audience. I appreciate you. And I'll talk to you soon.
Sounds great. Thank you for having me.
Awesome.